Welcome everyone to the webinar. My name is Mihei Jung and I am the Community Advocacy Director at California Pan-Ethnic Health Network, CPEN, located in the Los Angeles office. I will be your facilitator today, and we're really excited to bring this webinar to all of you, and we really appreciate the time that you're spending with us for the next hour. Next slide. So today, through this webinar, we'll be talking to you about why social determinants of health matters, specifically relating to oral health. Before we get into the webinar, I'm going to provide a few housekeeping items. Actually, can you go back to the last slide? Great. So before we get into the webinar, I'm going to provide a few housekeeping items. We have muted all of you. If you have a question, we have enabled a question feature to ask a question. You may need to click the orange arrow to show the control panel, and there you'll see the question box. If you think of a question for the speakers at any point, just type it in there, and I will either pose it to our speakers at that time or hold it for the discussion portion at the end of the webinar. So make sure that you think of lots of questions to ask, and then we'll do Q&A at the end. So I'm going to be aggregating those. Today's webinar is being recorded. We'll be able to share a link with you after the webinar is complete. We welcome you to revisit the content yourself and or share it with your colleagues. Please take a moment at the end of the webinar to complete a quick evaluation survey. We really value your feedback, and it helps us to measure our work and make sure that our webinars are meeting your needs. So thank you. So I'm going to do a little bit of introduction of the California Open Network, California Oral Health Progress and Equity Network. So this webinar is brought to you by several different organizations, as well as a California Oral Health Progress and Equity Network, the CA Open. And the CA Open is a California network, and we aim to build a healthier state by making sure that Californians have the keys to access good oral health. The California Open is building collective power to ensure that good oral health is a fundamental right for all of us. We bring people together, including providers, advocates, and policymakers, to exchange ideas, share resources, and collaborate for oral health equity. Access to good oral health is like, going through a series of locked doors. Some people have all the keys they need to unlock these doors, such as access to, fluoridated water, or job with dental benefits, access to dentists in their communities, but there's many others that are missing keys. And so without a full set of keys, people won't be able to access good oral health, no matter how hard they try. So by working together, we can help people get the keys that they need to unlock the doors to good oral health. So the grassroots leads organizations that you see on this slide right here, Visión y Compromiso, SCOPE, LCHC, Asian Americans Advancing Justice, CPEN, Fresno State, Central Valley Health Policy Institute. These organizations are a critical part of our statewide network of CA Open. They're not only members of this network, but they ensure that our network's approach is equity and social justice focused. So today's presenters will talk more about their own organizations as they present their information. Next slide. Okay, and next slide, please. Okay, so what is social determinants of health? We see this phrase thrown around a lot in the work that we do. Today we are here to just sort of unpack that a little bit and share with you why they're important to our work, and especially in oral health, whether you're a clinician or an administrator or you play, any other role in patient care. So our goal today is that you will be able to walk away from the webinar with a better understanding of what your patients or clients might experience when navigating their oral health care needs and how social determinants of health impacts their access to care. So what is a definition of social determinants of health? It is the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Next slide. So through our collective work as a grassroots lead organization, we have chosen to prioritize the following social determinants of health for the purposes of today: economic stability, healthcare systems, education, built environment, social engagement. Next slide. So I think that I'm ready to hand this off to our next speaker. So in today's webinar, you'll learn the definition of these determinants. We'll offer you some helpful data and share some anecdotal evidence that help illustrate the patient and client experience. So I'm going to head over to Hayam. Take it away.
Hi. Hi, everyone. Thank you, Mihi, for the introduction. My name is Hayam Megali. I work with the Central Valley Health Policy Institute as a research analyst. And a little bit background about the CVHPI, or Central Valley Health Policy Institute. It was established in 2002 at the CSU Fresno to facilitate regional research, health assessment, and leadership training to address emerging health policy issues that influence the health of Central Valley residents. Today, I chose to talk to you about economic stability as a category of social determinants of health, as explained previously by Mihi. So thank you, everyone, for choosing to attend our webinar today. Thank you. Next slide, please. As you see in this slide, you'll see a lot of elements that contribute to the economic stability that a family or a person can experience, and how these elements can have an impact on their health. So I'm just gonna walk you through some of these elements. For example, employment. For example, the job benefits that are offered by the job. For example, the health insurance, paid sick leave, parental leave, can affect the access to affordable medical care. For example, maternity leave has been associated with a number of positive health outcomes for both women and their children. Workplace condition, including psychosocial stress, long-term exposure to harmful chemicals or injuries, potential injuries, all of these stressors put people at risk for mortality and depression. For example, people in high stressful jobs may also exhibit unhealthy coping skills, such as smoking, alcohol abuse. Can all of these increase the risk for negative health outcomes in general? There is some disparities that can be experienced at the workplace. For example, education-linked disparities. For example, it affects people who work at individuals who with less education are more likely to have jobs that are physically demanding or include exposure to toxins. Gender-based workplace disparities. For example, men are more likely to work longer hours, hold higher status jobs. However, women reported more work-related physical and mental health problems. Racial and ethnic disparities also exist in the workplace. White are more likely to work in white-collar jobs, whereas Black are more likely to work in blue-collar service jobs. And also African Americans are more likely to be unemployed. Workplace inequalities among racial and ethnic minorities may cause anxiety, depression, and physical pain. For example, poverty, racial and income-based disparities are found among children. There was one study that found that 1/2 of children living in poverty have cavities. So we're talking about oral health, compared to only 1/3 to those living above the poverty level. In terms of race, the study also showed that Mexican American children has the highest prevalence rates of cavities, of experiencing cavities. We can talk also about food insecurity, the expenses that a family can spend on housing, on food, and all of that. All of these are elements to economic instability. Next slide, please. These are two maps of California. The first one that's on your left side of the screen shows the county unemployment rate across California. And the darker the color, it shows it's the higher percentage of unemployed rate, ranging in California between 2% to 22% in Imperial County. So there is some counties that experience higher unemployment rate than other counties. The right side maps show the percentage of population, the children population in poverty by county. So you can compare between the two maps, and it's almost the same with different colors. So you can see here that 19% of Californians under the age of 18 are living in poverty. This is the average, ranging between 36% in Fresno County and about 7% in San Mateo City. Next slide, please. So that's why I chose these two cities, San Mateo and Fresno, to connect the dot between the income, median income of a household, and the health outcome, and particularly oral health outcomes. So as you can see here, the map on your left side of the screen shows the median household income in San Mateo City. It ranges between almost 70,000 to 240,000. And the darker the color, the more concentration of earning in these census tracts. While the other map, on your right side, it shows the percentage of adults who lost all their teeth at the age of 65 or older. And you can see here same concentration where the lower income population lives. So you can see here the darker the color, the higher percentage of adults that lost all their teeth. And it ranges between 2% to 15%. Next slide, please. And here, Fresno County as an example of the lowest median income across California. You can see the purple map on your left side of the screen. Median income ranges in Fresno between 10,000 to 122. And the darker the color in the northern area, there is concentration of higher income population, these census tracts. The other map shows the oral health outcome for this population, and you can see that there is, it shows that the lower the income, the worse the oral health outcome for the population living in these census tracts. So you can see here that in these dark areas, the brown, it shows that almost 30% of adults living in these census tracts lost all their teeth by the age of 65 or older. And you can connect what are the health outcomes, the general health outcomes accompanied by losing their teeth. Next slide, please. As I shared with you earlier, that there is some disparities at the workplace according to race. So this bar graph shows in San Mateo the disparities between in income, median household income between Black as a race and people who identify themselves belonging to two or more races, Asian and white. And you can see here it's almost the double earning with a difference of 60,000 between Black and the highest income rate in San Mateo City. Next slide, please. In Fresno County, this is another example. You can see the difference between the Black and the white population. And you can see here the difference is around 30,000. It's almost also the double. Next slide, please. Yeah, so I want to leave you here with these two quotes from respondents or participants from a focus group that CDHPI have conducted with a group of community health workers to learn from them the barriers that they face or their clients face when seeking oral health care. It showed that from the focus group, competing priorities and high cost of dental care as major themes in this focus group. So, for example, one respondent, she mentioned that 80% of the population she serves are under Medi-Cal, and she mentioned that the Medi-Cal has very limited coverage when it comes to oral health care. And when it comes to dental, we all know that dental is very expensive. Another community health worker mentioned that she thinks that the population she serves, they prioritize medical care primarily and dental secondary. And when they choose where to spend their money, they choose to spend money on medical procedures instead of dental procedures. Thank you, and I turn it over to Eddie.
Hi everyone, this is Eddie Hu from Asian Americans Advancing Justice. I'm on the Health Access Project team. We are part of the grassroots lead organization collaboration formed around 2014. We primarily work with Asian American, Native Hawaiian, Pacific Islander, and other low-income, limited English proficient and immigrant community in California. Next, I'm going to be talking about the healthcare system. The reason we have another bubble on this side is to highlight the work that we as Advancing Justice have been doing around healthcare system and its navigation. If you can advance to the next slide, please. So in the healthcare system, health coverage is part of the social determinants of health, and health coverage should include the following qualities. It should be adequate, which should be sufficient, and it should be comprehensive, which will mean cover all the needed services as well as physical, behavioral, and oral health. And it should definitely be affordable, which is low cost, and accessible, which is absence of barrier, both physical and cultural and linguistic barrier. And most definitely, it should be of quality. And I just put the three different logos on here. These are the big platform that we can get health coverage from. Cover California, as you know, Medi-Cal, and also Smile California, which is their branch of Medi-Cal Dental. If you can switch to the next slide. So in 2015 to 2016, each GLOS has conducted extensive research and survey on California's oral health landscape. Advancing Justice and our 10 partners across the state survey over 1,200 people. We have found that over half of the respondents has had public dental insurance, which is Medi-Cal. And when we disaggregated by community partner, there were high rates of respondents without dental insurance among the survey. And they are primarily located in the San Gabriel Valley area, which is the east of Los Angeles, have the highest immigrant population, and also in the East Bay, in the Bay Area. If we can move on to the next slide. LEP folks have less access if you look at the purple section. Sorry, move on too quickly. But the next slide in here is healthcare inadequate continue. So if you see here, sorry, can you move back one slide? Yes, as you can see from the graph, that even folks responded they have access to their oral health coverage, but you can see the disparity found in public and private insurance. Large number of them have not used their insurance due to many factors. One is cost. Second, like Hayam mentioned earlier, competing demands like food, shelter, childcare. And third will be barrier like transportation or lack of understanding of the healthcare system and lack of trust in the healthcare system. If we take a closer look at the bar graph, majority of the people with oral health coverage still find their coverage either too expensive or not covering their service that they need. If we can move on to the next slide, please. So this slide is to highlight the high cost of care continue to limit access. Each group of the survey respondent have slightly different challenges in accessing care, but 47% of the respondent has said that cost is a concern for them. Even in the disaggregated data, costs continue to be the highest rate of challenge in dental care. If we can move to the next slide, please. Another part of the healthcare system is provider availability. And if you look at the red box, while 10% of the total survey respondents cited that their dentist not speaking their language was a challenge, but when we ask about their preference of having their oral health care access, 72% of the respondents stated that it's very important that their dentist speak their language, and 66% stated that their dentist should be responsible for providing an interpreter for the respondent if they are having difficulty communicating. And another bullet point on the side is we found from the respondent is a lot of the dentists really doesn't speak the patient's language, or they don't know how to request an interpreter, and they don't usually open after hour and or weekend, so it's very hard for them to access the dentist when that's the time that they're available. And also in the rural and remote area, there's continue to be a lack of provider in those areas. If we can move on to the next slide. The very last point that I'm trying to make is the quality. These points were borrowed from LCHC and Scope, who is also on the phone call on the webinar today. It's to highlight the respondent experience when they visit dental provider. People see quality of care as a priority when selecting a provider. A lot of the respondents reported that they don't really fully trust their dentist. We need to revisit and refine our regulation and quality of care so that community member will feel welcome in any dental offices, no matter what kind of insurance they have. And we need to build trust with their provider, and it should limit their likelihood of going to a clinic or provider in another country with unknown regulation and quality. This concludes my section. I'll hand it over to Veronica from Vision to talk about the next point.
Thank you so much, Eddie. My name is Veronica Arciga, and I work with Visión y Compromiso as a Promotoras Network Manager for Los Angeles County. And I'm very happy to present today about the education on the social determinants of health. Next slide, please. So who is Visión y Compromiso? Visión y Compromiso is a nonprofit organization that was established in 2002. Our mission is committed to community well-being by supporting promotores and community health workers. And we work towards a dignified life for everyone. Visión y Compromiso have the only and the largest statewide promotoras network in California, with 13 regions in California and 1 in Nevada. Our work is conducted mainly in California, but it has a national impact. Next slide, please. For those who do not know who a promotora is, I would like to share with you that promotores and community health workers are liaisons, in other words, links between their communities and health and social services providers. And I would like to mention that if you see the circle right here is the logo that we use for our trainings, because we believe that if we transform, and at the same time the families transform the communities. Next slide, please. Visión y Compromiso conducted 5 focus groups and surveyed about 400 promotoras in 2015, and all that work is included in this report that we called Oral Health is a Social Justice Issue. It addresses many of the social determinants of health that we are discussing in this webinar today. And promotoras belong to the communities that they serve and share similar characteristics as other residents. So the responses to the surveys really represent the need of the communities where they live. One of the results that I would like to highlight is that 80% of the promotoras said that oral health is very important for them, and 14% said it was important. I am highlighting this because many times we had a wrong perception that the community do not care about health. Very few educational campaigns exist about basic toothbrushing or flossing, and children and parents receive little support to build strong habits for taking care of their health. That's one of the comments that we had in this report. The most common barriers keeping Latino families from prioritizing oral health are related to cost and access, as just Eddie shared with us. At that time when we did the survey, just over half of the promotoras had dental insurance. Many other barriers we found in this report, and the main one was, as Eddie already shared with us, was the lack of dental insurance. People do not know that they qualify for coverage. Sometimes they can apply and maybe receive it, but they do not know. That we found was the inability to pay for dental care, did not have dental insurance, or even when people had dental insurance, they thought it was too expensive to receive the treatments. Other issue that we found was that they had no regular dentist. And this happened because sometimes, even when they have health insurance and they are aware of that, they do not choose a dentist or do not know that they were entitled to dental benefits. So a lot of education is necessary in this area. So another issue that we found is that people cannot take time off from work to go to the dentist. In this case, we found promotores from Madera and its surroundings who were saying that they did not have nearby enough dentists that were accepting medical patients. In that cases, they had to travel to other areas like Fresno to be able to see a specialist or to find a dentist who was accepting medical. So that is another barrier. We can see very clear how the social determinants play a big role in the health of the community. So going back to education, we found that for even those who have health insurance, in many cases, they do not know that they have dental benefits, or if they do know, they are confused in how to navigate the system. An answer to this is that they had language barriers or literacy barriers in language. If the person does not speak fluent English, or if the dentist does not speak the language, it is hard for them to communicate and understand among each other. We found also that even if the person speaks a language, in many cases, it's really difficult for them to understand the level of literacy that is used to explain the concepts to be able to navigate the system in a proper way. So in 3 words, the main 3 recommendations that we got from this, from the promotoras, is that they would like to see health to be more affordable. That means having a cost that is not too high. The affordable cost of dental care is a huge driver and includes the cost of care, some services that are covered and others that are not. That are attainable, that means within reach. For many, it is luxury that they cannot afford. And the third is accessible, and that means that can be easy to get and to understand. Can we move to the next slide, please? So for us, it is important to create awareness about the importance of oral health as part of the overall well-being, but education is not enough. Education goes hand to hand with effective advocacy to achieve those system changes. So Visión y Compromiso and many other organizations have agreed on the importance of integrating promotoras in oral health. Less than 30% of the promotoras have ever had training about oral health trainings, and 69% of the promotoras said that they could integrate oral health messages into their community work, but only 30% knew how to do this in a very effective way. So Visión y Compromiso developed this toolkit that we have in our website that to the community to educate them about this issue. Visión y Compromiso created a digital toolkit to assist promotores, comunitarios, to increase awareness and educate our communities about the importance of understand the healthcare system in order to access care and identify oral health resources. This toolkit was designed to make it easy for promoters to integrate key oral health messages that addresses the importance of oral health into their existing health education and outreach efforts. The toolkit contains messages of life. Promotoras have the option of using only one or all of the oral health messages a person or two. The toolkit comprises messages for 5 different life stages, and each one of them has addresses 7 different categories pertinent to each life. Like, for example, good nutrition on oral health, oral hygiene, oral health begins at home, going to the dentist, paying for your oral health, what your dental plan covers, and choosing the best dental home. So we have this toolkit for the promotoras that anyone can download if you want or wish to do that. And we already have a Facebook page that is called facebookpage.com BYC Salud Oral, in case you would like to access that well. Can you move to the next slide, please? So Visión y Compromiso believes, as many other organizations, that Promotora needs to be part of this solution. And we're already working on integrating promotoras as part of the solution. They are already being seated in different coalitions and health coalitions as well, because as I said before, having access to healthcare is important. The only coverage that really comes along with access to oral health services is medical. If you have a private insurance, if you have My Health LA or other insurances, you really don't cover California, private insurance, job-related insurance. You need to buy insurance on the side. So that's why promotoras can help the community to really let them know that this is something that they can get, but they need to navigate the system to learn about that. So education goes all the ways. Advocacy is needed for the program and services in each community, and for public policy changes to fix system problems with how medical or dental pays for care, to help people access care when they need it, to promote preventive care and ensure care for all. So hopefully all of us can learn together about the needs of the community so we can move forward our health for all. And that ends my presentation. I'm moving to Rosa Flores, who will be sharing the next part.
Rosa, I think you're muted. Rosa, I don't think we can hear you. We're just gonna give her a few minutes. Are you on, Rosa?
Let me try to finish.
Woo! There's a really bad feedback.
I hung up on my phone. Can you hear me now?
Yeah, Rosa, is that you?
Hello?
Yeah, we can hear you. Okay, apologize for having a couple tech glitches. We'll just wait until Rosa gets back
Testing.
on. Rosa? I am comfortable actually since Rosa's having a little bit of trouble getting on the webinar. Mayra, do you mind going before Rosa and we can close with her?
Yes, I'm ready.
Okay. All right. So can we skip to Mayra's slide, please?
Yes, hello everybody. This is Mayra Vega. I'm a community organizer from SCOPE. For over 25 years, SCOPE has built grassroots power to create social and economic justice for low-income and communities, people of color. And our commitment to racial and economic justice is grounded in community principles and community solutions. And this effort seeks to address health inequities in low-income communities of color. Can we go to the next page, please? I'm going to talk about community and social engagement. Can you go to the next one? Yeah, so we know that 39 million people live in California, and 2.7 of them, doesn't have a health care, and they suffer a different experience, additional challenges in accessing auto health. Who they are, the 2.7 people? They are the poor people living in poverty levels, city center residents, people with reduced mobility or special needs. These are people who culturally isolated, like farmer workers, transgenders, etc. The unemployed, the undocumented population. And separate from the other challenges, they have a really difficult time to find a good job, unionize full-time with benefits, and also find affordable housing for their families and apply for immigrants. They had to learn the English language as well. Some of the groups that I mentioned before, they have another challenges, and we can see on this slide, is immigration, criminal justice, poverty, disability, and workforce development. In immigration, is 11 million immigrants is their home, California, and that is about a quarter of the population born abroad through the country. And 60% of them, they don't have a health care because their immigration status. And most of those immigrants reported 69% that they speak English proficiently, while only 10% of them speak no English, speak Spanish, Chinese, including Mandarin and Cantonese. But also, we know the criminal justice, 81% people who are in California prisons, they are people who were born in the United States. And Black men are incarcerated 6 times more often than white men. That is hard for them. And 36,000 people released each year from California state prisons. And when they get out, it's hard to find a good job, to find affordable housing because of the background. And also, we know that foreign-born Californians are less likely to be in prison. And we can see also the poverty and disability workforce. Almost 41,000 people in California, they live in poverty. And 18% of them fairly close to the poverty line. And this is based on the census. And almost in 1410, 36.4 in state residents were poor or near poor in 2017. But also something good is that at least one family member in the poor families in California are working, but only 79.6 of them prove that they are working full-time. And 44.9 of those in poverty, only one family member reported working, but it's only 34.7, were part-time or part of the year. And they had to get out of their neighborhoods to find a job that sometimes is minimum wage with no benefits. The federal poverty line in California is 29,428 years, and it's only for family, 5 members family in a household. Also, we had 23% of people living in California that they have some disability, maybe in an accident or they born with that disability, and 33.1 are inactive with disability. That is people that are receiving social services. Can we go to the next one, please? Next page. In South Lake, we've been doing a lot of community engagement. You know, you can see some of the pictures that our members are not only having a house meetings, one-on-one meetings, listening sessions, but also they attending supervisor meetings to share their stories, you know, how they can live their real life the South Lake residents are facing every single day. So we know the system only benefits a few, and there is a curve of organizations like us, SCOPE, and the rest that you hear already, that we train and raise awareness among the poor and communities of color. We work together to bring hope changes to our community so they can live long, healthy, and be part of the society. Something that we're doing here in community engagement is organizing communities, doing surveys. I know already Eddie mentioned, can we go to the next page, please? So I know Eddie mentioned already some of the information, the surveys in 2015, 2016 that we made in California, but some of these numbers only apply for South LA residents. I'm not going through those on details, but I want to show you how many of those members prefer to go across the borders to go to Mexico to get auto health services, and also 47% say that today's was so bad that cannot focus on daily activities that include work, exercise, and go to school. And a lot of them are making $16,900 a year for 3 family members, and some range from 1 to 10 members. And sometimes they have a senior over 65 living in this household. And sometimes due to the high cost for services, many of them usually don't go regularly to the dentist. Next page, please. And this is only when they choose priorities for South LA residents. That is included on the information, the data that Eddie mentioned. You can see the good quality care is the most concern from South LA residents. And of course, they want to easy to get there because transportation, most of them are on public transportation, and they need to find a dentist or close to their homes, workplace, and in bus stops. And of course, access to payment plan, especially when people only are receiving Medicare and Medicare. That's it. Thank you.
Thank you, Myra. And we'll have Rosa back on the webinar if she's able to.
Hello?
Hi, are you ready?
Hi, me. Thank you so much. Sorry, I was trying to figure out the audio. I think either our Wi-Fi went down. I don't know what happened. Thank you so much, everyone. Hi, my name is Rosa Flores with the Latino Coalition for a Healthy California. Our mission here at LCHC is to advance and protect Latino health through policy and advocacy, and also through community programming, and build healthy communities throughout California. And although our work focuses on Latinx health, we also do a lot of intersectional work alongside other organizations, such as the folks that are on the webinar today. Our contribution today is sharing a little bit of a high-level overview of built environment as a social determinant of health. So next slide. So what is the built environment? Basically, it's what surrounds us, right? So it's the physical parts of where we live, work, and play. This includes our homes, the buildings, streets, open spaces, and our infrastructure. Next slide. Across public health, community health, and environmental health circles, it's a widely accepted fact that the built environment influences one's access to transportation. And this includes both active transportation, so walking, biking, rolling, and on-road transportation, vehicle, light rail, bus, paratransit. And therefore, it determines their access to parks, schools, libraries, grocery stores, and healthcare facilities. So we know that good transportation and reliable transportation is necessary for when we're discussing healthcare access, and that's our focus for today. Next slide. So what are the issues that are being experienced around transportation? The issues that come up the most are lack of vehicle access and insufficient alternative modes of transportation. This can look like missing bus routes or no badly structured bus stops. I included this image on the slide because that's what an ideal stop looks like. A really easy challenge for you all, maybe during your lunch break or during your commute home, is just to look at the bus stops in your immediate surroundings, right? Do they look like this? Do they have shading? Are they protected from the elements? Is there lighting so that it improves the feeling of public safety? Is there route information? And is that information in the languages that are needed in that community? Is there seating even? I always find it interesting whenever I go to communities, I do a little assessment on the built environment because I know that it will impact ultimately folks' health in that region. Issues also include long distances and lengthy times to reach needed services, and it includes transportation costs and, of course, adverse policies that affect travel. Next slide. Hello? Next slide. Thank you. I think it's important to note that transportation barriers affect both rural and urban communities. A little bit of statistics. Every year, an average of 3.6 million people in the U.S. do not obtain medical care that's needed due to transportation barriers. The issue is even bigger when it comes to communities of color who are disproportionately disadvantaged compared with members of the white population. So about 10 to 20 folks, more members are impacted. Additionally, the barriers around transportation are compounded. For example, if someone is suffering from a chronic illness or has a disability. Additionally, for our aging populations, older folks, there could exist other issues. People aren't unable to drive as much, and sometimes public transportation isn't reliable or it's difficult to navigate. A few folks earlier shared about the importance of having resources in the appropriate languages and how impactful different levels of education are in order for folks to navigate different systems. And this does not exclude transportation. Next slide. So let's connect the dots. How does this actually impact patient health? Well, transportation barriers can lead to rescheduled or missed appointments. This can be especially impactful for folks because it already takes a really long time to get an appointment. We've heard experiences where it takes anywhere from 2 weeks to a month to get in with a dental oral health provider. It also can lead to interrupted and delayed care, particularly when someone needs special attention. It can lead to missed or delayed use of medication. And it's not uncommon for a lot of folks, particularly in low-income communities, to wait until the last minute when the pain is really unbearable to seek help from a medical provider. And so there's an increased use of emergency department care. And all of this yields poor health outcomes and includes oral health outcomes. Next slide, please. So then we look at let's take a step back. We shared a little bit about the impact on the patient. Providers and clinics and healthcare facilities are impacted as well. Transportation barriers for the patient can lead to unused provider time, unused facility rooms. It also leads oftentimes to time spent contacting patients and rescheduling appointments. It leads to increased wait times for others, and this is especially meaningful because we know that a lot of facilities are already impacted, especially when it comes to oral health needs, and it can also lead to interruption of care plans for the health outcome, the health outcomes that we're looking for. And it goes without saying that all of these things have a cost associated with them as well. So transportation, addressing the transportation barriers and finding transportation solutions is a win-win for all. Next slide, please. I wanted to share a patient experience around the issue of transportation, just to illustrate how the built environment impacts folks. This particular community resident lives in the Central Valley. They are part of a community where there's a lot of agricultural workers, a lot of agricultural worker families. And so they are finding solutions to the barriers that they're experiencing. There were folks in the community that need to access medical attention, but there's a lot of they're experiencing a lot of the transportation barriers that I went over, where they're having to develop kind of a community organized ride shares, known commonly as raiteros, in rural communities, where they basically organize and find someone that can give rides to and from appointments so that they're able to access care. This helps mitigate some of the fear and the language barriers that are experienced by the community. But it's a very short-term solution, right? I think we can all work together to be able to better meet the patient's needs. Next slide. I wanted to touch upon, I know we're coming up short on time, but I wanted to touch upon really quickly on the impact of water, which is also part of our built environment. We know, and I think I included this picture because we know Indigenous communities have been advocating for the protection of water and access to water forever. And water is incredibly important to our health. So without access to clean water, it's incredibly hard to stay or be healthy. Additionally, fluoridated water can prevent things like tooth decay or other serious oral health disease. But it's not always accessible to folks. And this is because of a multitude of factors, but we know that only about 63% of folks in California have access to fluoridated water, so there's a lot of work to be done. Fluoridated water aside, just folks having access to clean water, a lot of folks go without, and some folks for years, some even close to decades. So it's incredibly important that we're mindful of that. And if it's in our environment, it's ready accessible, then we're not really reaching for other sources like sugar sweetened beverages. So I think it's important to make that point. Next slide. Next slide, please. Next slide. Okay. So as I said, over 1 million Californians per year lack access to clean, safe drinking water at some point during the year. Like I mentioned, that this is due to several factors. In some ways, the jurisdictions that we're working with are so small that there's limited resources in what the treatment of water looks like. And honestly, some folks are just doing the bare minimum. Additionally, there are things like the drought and other disruptions can limit folks' water supply, making it really hard again for folks to keep up with their oral health. This concludes the main 2 points I wanted to make. I'll hand it over to Mihei to finish the webinar. Thank you.
Great. Thank you, Rosa. Can we go back to slides after Mayra's? All right. So thank you, everyone, for presenting, and we went over economic stability, healthcare systems, education, built environment, and social engagement, and how each of these factors impact oral health. So we're going to actually jump right into questions because we don't have a lot of time. There is actually a question here. What was the reason for comparing with San Mateo instead of other urban areas such as San Francisco or San Jose? I believe this question is for Hayam.
Yeah. Thank you for your question. So the reason behind choosing San Mateo versus Fresno, because San Mateo was identified as least as the city that has the least percentage of children living in poverty, versus Fresno identified as the most within California. That's why I chose San Mateo.
Got it. Thank you. Next question. What is a source for the survey for Eddie's slides?
The survey is conducted with ourselves with 10 partners across the state, so the sources are from us. Those are all testimony and surveys from our partners, clients, and our clients.
Great, thank you. And the next question is, the statistics regarding how well prepared promotores felt in regards to oral health education, are those numbers in the Visión y Compromiso report? I think that's for Veronica.
Yes, they are. They're in the report that you can download from the website, our website, which is visionycompromiso.org.
Great. Let me see. Will the presentation be made available? Yes, the presentation will be available and the webinar will be recorded, and we will send everything out to you. And it will also be available on the CA Open website. The CA Open website actually has a lot of resources that you can leverage. So it is ca-open.org, and we have included a lot of different toolkits, webinars, data and research. We've included newsletters and outreach materials. We also have our policy priorities there for the network. So you can check out our California Open website. Again, it's ca-open.org. And you can actually join us if you'd like. And I should have probably added the screen capture from our website onto the slide. But basically, you can simply go to our website and click join us. And you can answer, several different questions and be part of the network. And you can also send us your policy updates, events, and other resources by emailing caopenoralhealth@gmail.com. So these are different ways that you could join. I don't think that there's any other questions that are coming up. So I think that I'm happy to close a webinar, but thank you so much for the speakers that have educated us with really valuable data directly from the community. It looks like there's one more question. Let me see here. I'm just going to wait. Okay. So the question is, would be helpful to know if and whether and what policies are needed to address social determinants of health, or to know how current benefits in Medi-Cal, like transportation, are being used and monitored. That is a great question. So again, the question is, would be helpful to know if and whether and what policies are needed to address social determinants of health, or to know how current benefits in Medi-Cal, like transportations, are being used and monitored. So we do have one more minute. Does anyone want to snag that question?
A lot of people
another question. Okay.
A lot of people have access, if they have Medi-Cal, they should have access to the non-emergency Medi-Cal transportation, but it's up to their doctors do they have to submit TAR, or do they not need to? So depends on the doctor. They can request those to use to go to medical appointments or non-related medical appointments.
Got it.
And if they have more questions, our partners, Maternal Child Health Access and also Justice in Aging, has a lot more detail. We can connect them with those two organizations.
Yeah, I think that's helpful. If folks want to follow up on any of the points made today, please contact CA Open or any one of us to continue the conversation and especially towards policy change. And also, before we close, I do want to announce that we do have a part 2 to the social determinants of health webinar because this is such a huge topic and we can't cover everything in 1 hour webinar. So we are having part 2 November 1st on Friday at 12. So we're going to send you a registration link, and I hope that everyone that came to today's webinar can also join the part 2 so that we can continue to have this conversation and go a little bit deeper. Okay. So we're really excited to have you here with us today. Please remember to fill out the evaluation after the webinar so that we can continue to improve our work. Thank you so much, speakers, for joining us today, and we will see you on November 1st at 12. Thank you.